What is fluid restriction? Fluid restriction is a medical guideline that limits the amount of fluid a patient can consume within a specified period, usually 24 hours. This restriction is commonly prescribed for individuals with certain health conditions where excess fluid can worsen their condition, such as heart failure, kidney disease, liver cirrhosis, or hyponatremia, which is low blood sodium levels. What is fluid restriction kit? A fluid restriction kit is an essential resource for individuals managing medical conditions that require careful control of fluid intake. Where fluid balance is critical, this kit offers the tools and guidance needed to monitor and limit fluid consumption effectively. The fluid restriction kit empowers the patient to adhere to their prescribed fluid limits, thereby reducing the risk of complications and promoting better health outcomes.
The next is the overview. Number 1, there are numbers of clients with chronic disease such as chronic kidney disease, congestive heart failure, and liver cirrhosis and hypertension. Number 2, the intake and output of these clients' condition must be monitored strictly. Number 3, fluid restriction kit that come with instructions, measuring cup, intake and output chart, and pen can help the healthcare worker. It can ease the healthcare worker and improve the client's overall health.
Firstly, the purpose of fluid restriction kit is it provides accurate monitoring of fluid intake using the tools provided to ensure that the patients do not exceed their prescribed fluid limits. Next, it also prevents fluid overload by enabling patients to stay within their fluid restrictions. Other than that, it helps the patient adhere to their healthcare provider's guidelines by providing a structured approach to fluid intake. Lastly, it enhances the communication with healthcare providers through the tracking logs, which enable more discussions about the patient's condition and any necessary adjustments to their treatment plan.
What is in the kit? The kit will provide patient's input and output chart, 2 measuring cups, a pen, and a written instructions of how to use the kit. All of this will be inserted in the seal bag. Both of the measuring cups will be labeled as intake and output, respectively. Patient need to use the measuring cup with intake label to drink, and the amount will be written in the intake column in intake and output chart. The measuring cup labeled as output will be used by the patient to measure their urine, and the amount of urine will be written in the output column in the intake and output chart.
Here come the benefits of the product. First, it can reduce cost. There is less need of intensive or costly treatment if managed the fluid properly. Second is, it can save time. No need to find the cup and write the measurement on the cup anymore. Next is proper fluid management. Accurate fluid management helps to prevent the complications. The fourth is optimized resource use. It can decrease readmission and any need of additional treatment. Lastly, it can improve health outcomes. Managing intake and output properly can get better overall health outcomes and faster the recovery process.
In conclusion, fluid restriction kit will help patients to adhere to the prescribed limit of fluid intake in their daily life and promote better health outcome. As a healthcare workers, it is important to make sure to give adequate health education about the importance of fluid restrictions and dietary intake. Some potential challenges, such as non-compliance, may occur. Thus, motivation and support are very crucial in order to make sure patients comply to the fluid restrictions and use the fluid restriction kit as instructed.